Hello and welcome to DocTalk, a Podaholiks podcast with Dr. Jenna Burton and myself, James Pikeway. And for the next hour, we're going to talk about those medical things that are on your mind in plain English. Last week we were talking about, well, children and childbirthing, etc. This week we're talking about pain and more. Dr. Jenna is here. Questions on the table. Let's get right to it. This is DocTalk.
The stage one tick.
Stage one tick, episode 2. This is good.
I know.
And I think that we had this great list last week or 2 weeks ago.
We didn't even get anywhere near.
We barely got through being a new mom and all that stuff. And I think there were still even things on that list that we didn't get to.
Yeah, and I also wasn't sure how much I could say and couldn't say. You know,
I guess you can say almost anything you want, really.
Because obviously previously when we did Dubai Eye, there were things that you weren't allowed to talk about. Obviously, podcasts is a bit different.
Yeah, I think within reason, right? Everything's going out there, and I think, hey, Dr. Jenna Burton, DocTalk, you can talk about what you want. It's all contextualized.
Yes.
So it's, and I thought...
I know, because it's difficult with the medical world, because we do talk about everything quite openly.
Right.
And you've got to be careful because...
Yeah. Well, I think even in this context, it's sort of, okay, let's explain things, and there might be some things you don't want to go into details on.
Yes, because even like at dinner parties, you have to be careful, because I will often start talking about things and you can just see people's faces change and recoil slightly, and you think, right, okay, change the subject.
Cross the line here.
Yeah.
And it was funny because as we were sitting down and I'd love to kick off. We want to talk pain, because I think that's really important. That could be the entire thing, because there's, you've had so many conversations with pain and childbirth and pain and postnatal pain and then just pain that we get all the time. I mean, you stand around at Boots Drugs is really close to where I live, and I kind of do this non-scientific observation survey where I'll stand there for 5 or 10 minutes and watch how many people are going to the pain med shelves, and it's a revolving door. People are grabbing Panadols, they're grabbing muscle stuff. It's like they can't keep it on the shelf.
Well, it's quite different here in the UAE as well with regards to pain, because obviously the choice of painkillers is quite different.
Right.
So back in England, for instance, so there's a pain ladder. So whenever anyone's in mild pain, paracetamol. A step up, you might look at a non-steroidal anti-inflammatory like Brufen. Then in England, we would then go to opioids. So you'd look at codeine, and then a step up.
Is codeine an opioid?
It is, yeah. It's like a little mini morphine.
I didn't realize that, because I mean, again, in North America, you can get lots of different on the spectrum that's over the counter that has codeine in. I didn't realize.
So
hence why it's not here.
Well, yeah, it's very common back at home as well. And I refer to back at home because obviously that's where a lot of my prescribing has taken place. That you just buy over the counter. You'd say buy cocodamol, which is paracetamol and codeine. Right. So you're effectively saying a bit of an opioid with a paracetamol, and you'd use that maybe with Brufen, and that's it is strong. It depends how sensitive people are to opioids. Yeah. So me, for instance, that would completely knock me off. So my husband got home one day and I had broken some ribs and dislocated one of them.
Was this doing CrossFit or something?
It was wakeboarding.
Oh,
so it was,
nice.
Yeah, it was funny because it was the first time I'd ever done it. And a few weeks previously, I had been doing kickboxing and I'd been really injured. And
this is pre-babies, or is this?
It's pre-babies, okay. Pre-babies. I still do kickboxing, but I don't spar anymore. And this guy who we used to call Frank the Tank, who was absolutely massive, he was huge, and he kicked me in both my knees, and they were black. And I may have had a little girly cry and ran out. Because it really
I would have had a girly cry and run out if I had bruised knees from the tank.
Honestly, I could hardly walk. They were just completely black. I just walked out and I cried. And they said something like, well, Jenna is a delicate little flower.
Oh.
And it really struck with me. So when I went wakeboarding, I was aware that I was in pain, but I was like, I am not going to show anybody the pain that I'm in. So I've got all these broken ribs, dislocated, popping in and out as I'm breathing. And I thought,
you must have been in terrible pain.
Yeah, it certainly wasn't comfortable.
But you still did it, because you're not going to be the flower.
Yes, exactly. And I was with the gentleman that had said that I was a delicate little flower.
Nice.
So,
are you still friends with this person?
Well, actually, he's moved back to America, so I don't see him as often. But I did to keep in touch with him and his wife. But and I understand he was like a big kickboxing guy, and to him I was a bit of a flower. And I often said, "Don't punch my nose" as well, so that never helped the situation. So I then a few days later decided this isn't getting any better. I think I've probably broken some ribs. Yeah. Went to have my X-ray, and my GP at the time prescribed me some opioids. And me and my husband were going out for dinner that night, and when he got in, he looked at me and he said, "Jenna, what on earth have you taken?" I said, "Oh, just a bit of codeine and paracetamol." He's like, "You look drugged." And my eyes were rolling. Really? I could hardly walk straight. I felt really nauseous. And yet so that's my experience with codeine personally. Yeah. Other people will take it on a daily basis.
Well, this is the thing, though. The opioid crisis in North America. I don't hear so much in Europe, but I can't believe that it hasn't experienced, the same things aren't being experienced there. Well, this is seriously, a lot of the people are hitting these through, as you say, through codeines and just upping the personal dosages that they're taking.
Well, it's not just opioids. So you've got opioids, you've got things called benzodiazepam, which is like, we call them the prams. So you've also got lorazepam, midazolam.
Nice names.
Yeah, they tend to be more like general relaxants and also muscle relaxants. So Xanax, for instance.
Okay, yeah.
That's one that's a lot of people are addicted to. You've got your opioids, and then you're going on to even harder stuff like sort of morphine, which is just a higher level of of opioids. But with these, they tend to be addictive. Now,
a lot of these are over the counter too. I mean, at some point when you get to the pans, those are prescription based.
They're actually controlled prescription as well.
Even in the UK.
No. Not in the UK, you can just prescribe it.
These things are absolutely controlled here.
It's so, funnily enough, the UAE and also Australia are very strict about their painkillers. So if a patient came in with back pain, which is a real common situation to have, sort of high-end pain that you can't sort out, if they came into England, we'd give paracetamol, then a non-steroidal anti-inflammatory, then an opioid. All right. In Australia, it would be paracetamol, and then it would be a benzodiazepam, for instance. And then you would give opioids much higher up the scale, because you'd also sort of add brufen. And here in Dubai, I'd say it's the same as well. So I don't know why Europe, UK, America are behaving so differently with their pain prescriptions.
And I think people don't realize how easy it is to get addicted to any of them, though. And, the feeling, the relief that you get, and you want more and more and more. And as the addiction goes on, you need more and more and more to sustain the same feeling.
Well, that's it. So imagine you've been in really chronic pain forever, and then something makes it better. Yeah. What a wonderful... I can totally imagine it. Yeah, and you probably would also get a bit of a serotonin release from that, which is our feel-good hormone, as in, finally, I feel a little bit better. I've got more life back. And so it almost becomes addictive and a psychological thing of you don't want to go back to that feeling beforehand. And plus, they do make you feel different. So if you were to take an opioid or we sort of call them benzos for short. If you were to take one of those, they would relax you. They are generally relaxants, which is one of the mechanisms of how it reduces the pain anyway. Okay. So it's because you don't get it with paracetamol and you don't get it with ibuprofen, hence why you never really hear of those being used as sort of addictive type pain medications.
Are there other things that happen with those though? I mean, over time?
Paracetamol, I've heard before, be referred to as one of the safest drugs in the world. Okay. Which people don't realise because we're so worried about paracetamol overdose. Yeah. Paracetamol overdose is very different to having a small daily dose of paracetamol. So in high doses, it's toxic to the liver. However, don't forget, whenever you take too many medications, they stop working as well. So that's a side effect. Well, it's kind of like you get saturated and you get used to having something. So no, you don't get any other side effect other than a bit of pain relief and a bit of inflammatory effect. For ibuprofen, again, no sort of feel-good factor from taking it. And the long-term side effects of ibuprofen are really quite bad. So it's a gastric irritant, so it can cause a lot of problems with stomach bleeding. And often if you're prescribed it, you have to be given a different type of medication to reduce your stomach acid. So it's not a particularly nice medication. It's not one that you'd want to use long term.
So, I mean, there's a lot of people who are taking these things, though. Is this why I see so many people heading in for the Nexium aisle and all that kind of stuff? I mean, I wonder that because again, it's always people of a certain age.
Yes.
But there's a lot of people who are going for things for stomach acid. And I know our diets can be pretty rich. But I wonder if it isn't this, if there isn't some research to be done, is it the people who are going for all those other painkillers who are also then needing to hit the stomach acid aisle?
I would say quite confidently that yes, they probably are. So the people that are going for the painkillers will often even be prescribed that stomach acid, that Nexium medication to protect them, because if you're taking lots of Brufen every day, then it's eroding away the lining of your stomach, and it can cause some very serious bleeding, ulcers. It's actually relatively dangerous. Now, if you're someone that is prescribed Brufen on a daily basis and you're not having any symptoms of reflux or stomach problems, chances are you're absolutely fine. It's not something that we need to monitor too closely. Symptoms come.
What worries me, sorry to interrupt.
No, it's okay.
But what worries me is that and sort of going on in my mind is, what about people who are doing the self-medication of all this stuff? Because there's a lot of people who are going, I don't want to go to the clinic, my insurance isn't that good, or doctors come and go, like yourself. You've come back, but maybe you're at a different clinic, you're doing a different thing, and it's finding that person, that GP, to track you and follow up on what's going on. And some people just say, I know what I need. My friend did this. It seems the same. I'm going to go get what they got.
Well, that is a huge problem for so many things. We're not just with sort of a omeprazole or ranitidine, which are the most commonly prescribed PPIs. Yes, huge problem, because like you say, people copycat what their friends have done. If you take omeprazole, say, which is Nexium, say you take that every day, again, your stomach grows used to it. You develop a tolerance for it. So then you start to have to increase your dose. Now, some people might be on a higher dose and you might copycat that higher dose, and therefore you've got less wiggle room for if you need more in the future. Plus, if you reduce your stomach acid too much and you ever had a problem like an ulcer or more so, I'm thinking like a stomach cancer, actually, there's something that's really eating away at your stomach, you don't identify symptoms as early.
Oh, wow.
So therefore you won't get the pain that tells you need to go and seek help and have someone have a look with a camera down into your stomach. So the long-term effects of taking these tablets are, one, you might not identify a malignancy potentially. Two, sometimes it's good to have symptoms because it gives you a heads up that I might have an ulcer or there's something going on. And three, also the long-term medications of any kind are not good, and omeprazole, for instance, has been linked with osteoporosis, where you have a slightly reduced bone mass.
Yikes.
But
this is why you need to have a doctor following you.
Well, yeah, and it's a shame that we don't have that doctor-patient relationship, the long-term one that we used to, where the GP had looked after the parents, the grandparents, for as long as they've been alive. I think
my brother still goes to the GP we went to as kids, and I'm thinking he must have just been freshly graduated because I thought he was 100 years old then. And he said, no, I still go to him.
And they're having a real problem trying to keep doctors in the trade as they get older.
Really? I can imagine that.
And we all move around, especially in an industry like Dubai when it's private.
Oh, man. For me, this has been the killer. I've been here 19 years. I think we've gone through 4 GPs. At this moment, I don't have one. And someone said, well, who are you going to? I said, touch wood, I haven't had to go to anyone yet. But
it's good
I don't know who I'm going to at this point. I'm asking around, and who are you using? Who are people going to?
But James, you've got to go anyway. So even if you've got no symptoms, you should be going for that sort of yearly check-in, especially if you do have the luxury of private healthcare. There's nothing wrong with going every year to get a set of bloods and just have a chat with the GP.
You think we need that?
Personally, I do. I think they often say over the age of 50. However,
why you think I look over 50? Because I know.
No, I know you're not over 50.
I actually am.
Oh, are you? Yeah. I actually didn't know you were over 50.
53.
Oh, James, you're looking great.
You see, there you go.
But I still think that like anybody would benefit, because there's always little niggles that you just think, I'm not going to go and talk to the GP about.
Always, everyone's got that. I don't want to go and have that conversation. I don't want to take off that bandage and then find out there's something going on when.
Yeah, and ultimately they will end up saying, right, well, we'll just go and check this out, or we'll just do an extra blood test, or maybe a referral. But, you know, we invest so much time in other things and not in our health, and it's so important. But I need to say, because I mentioned something before and it's sort of in the back of my mind that I just need to counteract that.
Sure.
I was talking about the risk of taking PPIs like omeprazole, which is Nexium, as I said, and ranitidine. However, if you are listening to this and you are taking them, don't just decide to go cold turkey and not take them, because that can lead to other side effects and other risks.
I think you need to be guided in taking these things, even though you can just go up to the pharmacy here and say, okay, you know, give me the, I don't know, 40 milligram tablets. I don't even know what milligrams they come in, but you can do that because I know it's over the counter. I've seen people with it. But get direction from your GP to make sure you're taking the right dosage and that you need it. Maybe it's week on, week off in your own situation. Who knows? Or maybe you don't need to take it anymore.
Well, the problem is that Professor Google is a really great
It's terrible, isn't it, for your profession? People come in and they think they know everything already.
I mean, in one way, it's great because people are getting educated and it's encouraging people to go and get checked out and, you know, maybe warns people a little bit. Yeah. But on the same token, it can frighten people. That's one thing. But they also make medicine look very black and white. So if you have this, you need to do this. It's like, oh, easy. This is, got this. Who needs a medical degree? Yeah. And I'm not just trying to sort of inflate our profession. It's like with anything, there's all like bits of grey in between. Yeah. And you have to take into account so much about that individual person. I mean, not with everything. Some things are quite straightforward. You know, if you have burning when you go into the toilet, you've got low abdominal pain, you're feeling a bit under the weather, the chances are you probably have got a urine infection and you need the first line type of antibiotic. You know, some things are relatively easy, but some things aren't. You know, what if you're on other medication that antibiotic reacts with it?
This is the other side, isn't it? We sometimes don't think about all of the things we're taking, including those things that might be homeopathic, and maybe I'm doing some sports stuff, and so I'm taking some powders and this and that, and then I'm mixing that up with, I've taken some antibiotics for something else, and then I'm wondering why my head's all cloudy or why, you know, I'm getting stomach aches, and it's like, well, because no one's asking the questions. Well, maybe your doctor, well, what else are you taking? Oh, I'm doing this and this and this, and what else are you taking? And
do you know, it's so funny because it's a bit of a joke actually when you're taking a history for someone. You just say, you know, do you take any medications? And they'll often say, oh no, you know, paracetamol now and again for a bit of arthritis. And then you look at their past medical history and it's so extensive. So you say, okay, do you take any pills, potions, medicines, tablets, liquids for absolutely anything at all on a daily to weekly basis? And they're like, whoa, does this count? Does this count? And I mean, like really serious medications, because everybody forgets what they take. Yeah. And you just think, oh yeah, it's not really important, but it is. So even when a patient tells you their history, especially if say they were in hospital and they're really acutely unwell, you would always try and seek a list of their repeat prescriptions from their pharmacy. And like you say, it's not just what's prescribed, it's people can be taking things that are holistic, and the foundation of all medications has come from a derivative of holistic plants. And
I remember there was something, I can't remember what medication it was, but it's something to do with grapefruits and some medication.
Warfarin.
Yeah, that you shouldn't put those two things together. And I was going, how do people know that? Like, fortunately, I'm not on that medication, but I'm thinking, oh, that could be really dangerous.
Well, that's it. And a lot of these medications that are herbal, I've got nothing against them as long as you get it from a reputable sort of person and supplier. And I do believe that there is definitely a place for homeopathy. However, it has to be regulated because they do contain medications or sources that you'd find in normal prescriptive meds as well. Yeah. And so you need to know how they interact. There's a big problem as you age called polypharmacy. So is
polypharmacy?
Yeah, it's for somebody that is on so many medications that they interact and they can end up making the person more ill than better. And again, that goes back to the GP, because normally you go to hospital, say, you get prescribed a new med. Now the hospital should go through and check that nothing is reacting or interfering.
Which is why the UAE wants to put all of our information onto our Emirates ID.
Which is an excellent idea.
Yeah.
But what you really need is when you go back to your GP who's prescribing you regular meds, is that they'd be like, right, okay, you now on this. Maybe we should just review whether you should still be on these medications or not.
Yeah, that's a good idea.
And so otherwise you end up with just lists and lists of meds that make you really poorly.
Well, I always think about all the people who are taking high blood pressure things and cholesterol things, and it's like, oh man, what else are you taking that this is going to interact with, and how long do you need to take them for, and do you do I need to put down the dosages? And how often do people check this out? And how often do they just give up and say, well, I'm on it for life and I'm just going to keep taking this?
I mean, there are certain medications that you will be on for life. So if somebody's prescribed warfarin because they've got a very irregular heart rhythm, chances are they probably will just brush the teeth, take the tablet, forget about it. Same with something like an underactive thyroid. However, you need to reevaluate at a regular basis. So just like you said, high blood pressure is a great example. Someone may have high blood pressure, but in the meantime, they may have lost a load of weight, got really fit, and actually the blood pressure's come down. Plus,
which is pretty incredible, isn't it? I've seen this happen with so many people who've had high blood pressure, and then they've lost, 20, 30 kilos because they were morbidly obese, and they finally realized they wanted to do something about it. And all of these health issues, from knees to blood pressure to cholesterol, all vanish.
Yeah, and diabetes is the big one.
Yeah.
You can actually reverse diabetes.
I've seen people do that, and it's like, really?
And that is surefire the best thing you could ever do for yourself. I mean, diabetes, blood pressure, cholesterol, they're all really nasty chronic diseases that, nobody wants to have. And yes, you can take a tablet and it might help you, but it's certainly not going to reverse things. And I probably have used this expression with you before, James, but it's one of my favourite in medicine, and it's Mother Nature doesn't give you anything for free. So if you
know what, you've never used that, but I like it. No, but I like that.
Well, it's if you take a tablet, yes, it will work, but there'll be a cost. And that's always the way with any type of medication.
I always get worried about that. It's I'm the person when the doctor prescribes something, and and if they say take the antibiotics or whatever it is, you're on this for 5 days. I follow it for 5 days, but I always read that little white sheet that comes with it, with my extra glasses. I'm gonna have to put 2 sets of glasses on for the magnification, but I'm reading all the stuff, and that's when I'm going, hold on a second.
Right, so now we're talking about the other extreme.
Yeah, I'm reading all the extreme cases, and I'm going, whoa, I'm going to make sure that everything's, and I'm reading the potential side effects, so I'm going to keep this list out if any of these things start to, and one time, I think when one of my boys was on medication, and I remember one of these side effects things kicked in because it was, it was doing its job, but something else started to happen. And we got on the phone to the pediatrician right away, and she said, no, get them off. Okay, stop taking them right now.
Immediately.
We'll put you on something else, because who would have known that you would have this effect?
Well, that's it. So,
which again, follow the someone nature. Guiding us through it, and knowing that everything you're going to do, there's some payback involved.
But there's 2 different types of people. So medics generally, so people like myself, would be quite quick to pop a pill, because it's like, why suffer? Just take a tablet, you'll be absolutely fine. And in fact, my husband, sorry James, I'm going to share this, but he has chronic sinusitis, and I remember his mum saying, Jenna, have you not got James to take that spray before? I said, Judith, I pinned him down on the bed and I've shoved it up his nose before to make him take it, because it's like, why are you suffering every day? You don't need to suffer. The side effects are so minimal. Then, and that sort of echoes somebody like my grandma of a totally different generation. She's 92, and up until very recently, she didn't take 1 tablet.
Really?
Yeah. So we went
up till 92. She's like clean slate.
So
that's incredible.
She's just recently in the last few weeks had a stroke, actually, and she's doing all right. Okay. She's doing all right. Yeah, she's okay.
Because there's very, this is sort of my, I don't know, maybe it's a stereotyping stroke victims.
Yeah, you imagine.
Well, because there's so many levels of stroke that. From people who are, like Luke Perry had a stroke, and that didn't end well for him. And then other times people have strokes and there's complete rehabilitation and recovery, or they're just caught it very early, or I don't know. It's like to me, it's that mystery world stroke, and it's just, I have a vision.
It's quite a fascinating thing, strokes, really. So for my grandma, for instance, all that happened is she couldn't make a sentence. So she could say words, but she couldn't make a sentence.
Really? And was that a dead giveaway then to...
Well, my dad called me and I said, because I often speak to my dad, and I just said, like, how's grandma? He said, well, she's okay, but she can't really make a sentence very well. And I said, Dad, you need to take her to the hospital, because if you have 1 stroke, there is a risk of having a bigger stroke just a little bit later. And he said, right, well, I've just finished my cup of tea and we'll make our way. I said, no, Dad, put the cup of tea down and you take grandma to the hospital now. Now, she's speaking really quite well now, but that was her stroke and it was identified on the CT. No other neurology at all, no other symptoms.
So how do they help her with that?
Well, it depends on what type of stroke it is. So if you catch somebody very early, you can often do something called thrombolysis. So if they've got no other risks of basically thinning out their blood, you can try and thin out the blood to the point that sort of the blockage is cleared a little bit.
So what is a stroke? It's just a blockage that cut off oxygen to a part of the brain?
Yeah, so which is exactly
like a clot?
Exactly the same as a heart attack. So I always say you need blood and oxygen to survive, and you need it all over your body. If you get a blockage, which is normally made up of fatty tissue, if you get a blockage, then the blood can't reach part of the brain or part of whatever organ it is, and that will be starved of oxygen and it will die. So if you do that, if that happens just before the sensory nerves in your brain of your leg, then you won't be able to feel your leg, and that's your stroke. It can happen for your little finger on your left hand. It can happen so that you are totally like paralytic and you can't walk anymore. And sometimes it can be on one side, sometimes it can be on both sides.
Wow.
But that is exactly the same way as it would happen in a heart attack. But there is a different type of stroke. So if you have really high blood pressure, and from personal experience, I actually don't know whether this is a fact, but I have found more men tend to have something called like a hemolytic stroke, which is where the pressure is so high and the vessels are very small and fragile that they can bleed.
Wow.
And then where they bleed, post that you can't get oxygen to where it needs to be.
Interesting. So in the case of your grandmother, no, it was small. They seem to have caught it. It's working out.
It is, but she has got medication that she now needs to take, and rightly so, to sort of avoid having another stroke. Yeah. So she's got that little white leaflet out, James, and she's saying, I don't want to get this, I don't want to get that. And I don't know how to say nicely to my 92-year-old grandma, that's if you take it for 20 years. You know, we're not talking about taking it for, I hope, a decent amount of time, but unfortunately unlikely to be 20 years. So you have to weigh up the cost benefit, don't you? Mm-hmm. And that's what you need. You need a mediator that weighs up the cost benefit, or at least assists you to do that.
Yeah, interesting. Very interesting. Well, that's I've learned yet another thing today, which is good.
That's what we should aim for, isn't it, James? Yeah, it's one thing a day.
Well, I wanted to jump back just for a second. I know we sort of had a little bit of conversation about pain stuff and making those choices. You just went through having 2 children. I mean, that's a little while now, but epidural or non-epidural on your?
Oh, epidural all the way. Why would you suffer?
But does anyone not go with an epidural? I mean,
loads.
I mean, there's and then there's the folks who don't want the epidural and they wait too late so that it doesn't actually have any effect anyway.
So randomly, everyone that I meet is different. I think I'm in the minority for having an epidural amongst my friendship group.
My wife had epidurals for both our boys.
Honestly, wonderful, wonderful things. But my words to the midwife, because we have the midwives back in the UK that deliver sort of babies.
So is this at home?
We were in the UK for
but
our delivery.
Were you actually in your home, or did you go to the midwives don't come to the house anymore?
They do actually. Oh, okay. You can have that, and a friend of mine had it. And you know what? This is a really sensitive topic because some people feel very, very strongly. So what I will say is it's totally up to everybody what they do. My personal opinion is always prepare for the worst. Yeah. So why would I not want to be in a hospital in case something went wrong? And I had to be because we had twins anyway, which is a high risk birth. But I said to the midwife, like, I kind of just am curious, like, let me experience some contractions before you give me the epidural. And then the epidural came really late because by that point, they had to wait for my bloods to come back and everything happened quite quickly. Then it didn't work.
Oh, no.
So I got a much bigger experience of contractions than I ever really fancied. And then as soon as they started, I turned to my mum and my husband who were there and I just said, oh, it stopped. Labour's stopped because the pain had completely eradicated. Wow. Wonderful thing.
But you could still feel the birth, and you know when to push and all that, or no, not really.
They tell you when to push. I couldn't feel it. You can feel like a bit of tugging because the sensation for movement is very different than the sensation for pain. Okay. So it numbs the pain without numbing the movement. Okay. And when I mean movement, I mean like tugging, like you can't move your legs, but like the tugging and sort of shoving. But if they hadn't told me to push, I wouldn't have known.
Oh, okay. But in your case, I know in my wife's case, the epidural there was no question. But I think my wife actually started thinking, not going to go with the epidural. And then after some of the contractions coming through and increasing was like, you know what, why am I doing this?
Well, it also depends on what your partner is like too. Yeah. So I had a friend.
Well, I sort of went, hey, I'm not having the babies. If you want the epidural, hey, by all means, you have whatever you want.
And James, that's a lovely, lovely response. And I bet she just loved you that little bit more for saying that at the time. But I've had friends who have been desperate by the end. They've tried to do it all naturally. There's a big, huge thing on hypnobirthing. Don't have any medications.
Hypnobirthing.
Yeah, where you breathe your way through it. And in fact, the courses are relatively costly, and yet they are very well attended. And I have had friends that have hypnobirthed themselves through labour and have had a very positive experience of it. And I've had others that have started and then been like, give me the drugs. And sometimes their partner's been complimentary and said absolutely whatever you want, and other times they've actually said, come on, you can hang on in, you don't need to take them. Which I get, like they're trying to help them get through what they wanted, but at the same time I think they've often felt quite desperate of, please just take this pain away.
Well, which brings me to the other conversation, because now you've got these two lovely boys who you must have gone through, and this is staying on the pain thing, you've gone through some earaches now, you've gone through some colds now, you've gone through pain that they're undergoing now. How are you dealing with that? On the flip side, back down to children.
It's funny, isn't it? Because you're so much quicker to take something for yourself.
Yeah.
And you definitely question it a little bit more with children, especially your children. Because you can't quite describe...
Which is funny, isn't it? Because like you said...
You question everything differently, don't you, though?
Yeah.
You know, you've been through it too.
Yeah, for sure.
You just debate everything. So, in fact, we've got a little boy that's a bit poorly at the moment. And his brother copes much better with pain than he does. So he had it a few days ago. And now our little Lincoln's got it. And it's awful because you want to make them comfortable.
Yeah.
But you don't want to give them something unnecessarily.
Yes.
So I would say, I think my husband would say I was quite quick to give them something, but I would disagree with that. I'd say my threshold is much higher with them. I don't want them to be crying. I don't want them to be like so unwell, but at the same time, I don't just hand it out. Like for instance, the boys sleep really well when you give them paracetamol. They just do. And our boys have been terrible sleepers. I've now had pretty much 4 nights of very, very little sleep, James.
You look fantastic, and you're doing great here.
I went to a CrossFit class this morning, and I said, if I don't vomit through this class, that would be the goal for me. Because
is this the class where, side note here, so just pause the pain and Lincoln in that, but this is the class where you're pulling someone around on a sled? I saw a few Instagram shots.
This is not. Today was more fitness than strength. Okay. But yeah, that was a strongman class. I love those classes.
That was crazy.
You have to carry big sandbags and run as fast as you can. And then they've got something called a yoke, which is this big, massive metal bar. In fact, it's a frame, and you have to just walk as far as you can, sort of backwards and forwards with it. And you waddle like a duck trying to keep it on your back. And I don't know why, but I love it. I absolutely love it. Got a sort of
Where do you do this? Where's your CrossFit gym?
I go to Base 3.
Okay, Base 3. Or I guess it's called a box, right? They call it a CrossFit box.
They do, but you know what's nice about this one is that it
looks giant.
It has windows.
Yeah, it looks huge. Where's Base 3? Where is it?
It's not massive. It's in JLT.
Okay.
In the Messiah Business Avenue.
Right.
And what I like about it, I don't go that regularly because I do other bits and pieces as well. But what I like about it is it's just so friendly, which
makes a difference.
Especially sometimes, not always, sometimes in CrossFit it's a little bit competitive. Yeah. And these guys, everyone's really supportive, and it's just a really nice place.
Nice.
Yeah, so that was that. So I didn't vomit this morning. The boys don't sleep. Mum says, Jenna, every night, just give them some, if it works, give them the paracetamol. And I'm like, Mum, I'm not. I love you for your suggestion. Yeah. However, I also love my boys.
She's just thinking of you, but
I'm not going to drug them to get them to sleep. And I think that is something that used to happen a lot, believe it or not.
Yeah. I always wonder, and I know we talked about breastfeeding last time, but I wonder how many times in the past, or maybe people still do it now, who are breastfeeding and they have babies who are a little troubled or, don't sleep well. So have a shot. Breastfeed a little bit. Does it metabolize that fast?
That's quite an extreme version. Having a full on Jaeger bomb or something before you then go to breastfeed.
I wonder.
A few of my friends may have had a glass of wine.
Yeah, well, that's what I mean. Just take the edge off.
Have you not heard of pump and dump?
No.
So
Sounds terrible.
But this is what you do. So on a night out, my friends would take they'd take a breast pump in the handbag.
Yeah.
And then in the bathrooms whilst they're drinking, they'd be pumping their boobs and dumping it down the toilet. Because the idea is you're supposed to get rid of some. Yeah. Whether they do it on purpose, I'm sure they have. But you just got to be so careful for a number of reasons, because you're so tired at the beginning. So when you're still breastfeeding, you're so exhausted that if you did have a glass of wine, I mean, you don't know what would happen. I've been so tired before that this is without any alcohol whatsoever, I have picked up one of the boys, put them on the bed, at the end of the bed, not realised, and got back into bed and left him on the end. And I woke up and I felt sick to the stomach, and I don't think I stopped thinking about it for quite a number of days. Yeah. And I was frightened, and that was because that was just tiredness. So then that's bad enough. If you add alcohol into the equation, you just don't really know what your body is capable of. No. And second of all, obviously, you don't know sort of what levels the child's getting. So what do you do for pain relief and things for your boys? I mean, as you said, you jumped in this case, but typically, what's your pattern? What do you do? So you'd see if distraction worked for a kickoff. So see if you can distract them a little bit. Sometimes playing games or Peppa Pig works a treat. Just see if you can get them to be a little bit more comfortable just by diversion
until they get tired enough that they just fall asleep.
Yeah, or let them sleep. Like often they're just craving sleep because they need to recover. Yeah. And then if that didn't work and they're just really unhappy, then I would give them some paracetamol. Yeah. I try and give them paracetamol once going to bed, and then try not to give it during the night unless they're really, really upset. Because then that's just reducing one dose. Yeah. But you don't want them. You shouldn't use paracetamol. For it's quite a common thing to use paracetamol for fever, and you shouldn't.
Yeah, isn't it? Well, because I mean, this is a big thing with kids. Fever is huge. So what are we supposed to use for fever?
So first of all, you want to strip the child off as much as you can. Okay. So everyone will think, oh, they're not well. Let's wrap them up as much as we can.
Well, that's what everyone does.
Yeah. Have you heard of what's it called? God, I've not heard of it in a while. Where you have a baby. God, I can't believe I can't remember the name. Basically, you can have a fit if the child gets too hot. Yeah. So they'll have a full, almost like an epileptic type fit. Wow. I mean, if you ask a medical professional, most of them would know. It's just literally gone out of my head. So you have got to be very, very careful. So you need to remove all their clothes as much as you can, make them cool, let them cool off. And then we will have a tendency to give paracetamol to reduce the fever. Right. However, the theory is you're not supposed to do that. You're not supposed to give paracetamol to reduce the fever. But yet, if I was to look back at practice of almost
everyone does that.
Yeah, I was going to say every healthcare professional I know does tend to, but the bottom line is you're not supposed to do that. So try and avoid it. Try and strip them off. But obviously, paracetamol, it makes them feel better, and it does help kill the fever.
Yeah. So one of the challenges that we faced and that everyone faces is as you're trying to keep your boys healthy, you got colds, you got coughs, you got rashes, you got all sorts of junk, and then you factor in nursery.
Oh my goodness.
How do you deal? What's your thinking on all that? Because, and it's just like, pick nursery now, pick school later. I remember my boys always had something. Yeah. And we didn't do nursery, but it was play groups, and then it was reception, and as the years went through, they always brought something home from school. I mean, and I don't know if they really did or if it was just my imagination, but it would just seem that there was always something going around.
But they don't do it now, do they? So as they've got older, they don't. So it's a necessary evil.
Yeah, I wonder why. I mean,
we know because they've got their immune system.
Okay.
So it's like sometimes the boys would get something and I would so they've just both had a cold. Yeah. But I haven't had a cold.
Oh, that's good. You're lucky.
I
Your immune system must be good.
I like to say I've got the immune system of an ox because, for instance, whenever we start a new placement in the hospital or in a clinic, everyone gets ill. All the healthcare workers get really poorly because the new bugs that you're not used to. Yeah. But then by the end you stop getting anything because you've now built up your immune system for those particular strains.
Right. Okay.
So children don't have any real experience, so they might have got a bit through breastfeeding, but then they also might not have got any at all. Yeah. Depending on if they're sorry, I'm just having a microphone.
I know what's going on there.
It's sort of coming very close to me, James.
It's caught up to you. You can loosen that arm there. Yeah. Yeah. and then you can push
it's
it
getting
away.
cozy.
Yeah, and then you can pull up the
cozy.
other side if you want, and I don't know. You can
that
just take it
better?
out and hold it if you want.
I might just take it out.
Yeah.
And hold. I feel I might start singing you a song though. That's the only thing, because that's what.
There you go.
I associate sort of speaking into a microphone like this.
There you go. So that you can just break into karaoke. Anytime. Yeah, I don't know what's going on with that mic. It just came right towards you.
No, it was getting
monster.
very cozy.
Yeah. You can just kick it out of the way, that mic stand, if you want.
It's all right. It's fine. But yeah, with regards to nursery, so I actually have a few friends that are having quite big issues at the moment because their children can't catch things, and if they do, the children could be very poorly.
Oh.
For instance, holes in hearts, and it's normally heart related.
Okay.
Or in fact, there's another set of twins, because often with prematurity you have problems with their lung development. If they catch a cold, they end up in hospital. So in those circumstances, you should avoid going to nursery. But trying to avoid nursery just for a normal child that is healthy, to stop them catching colds and coughs and sore throats, I actually think is a bad idea, because you have to let them build their immune system, and it's just it's difficult. It's not nice for them. It's not nice for you, but it is just that necessary evil, really.
Do you have any special treatments for coughs? Because that seems to be
a real common one.
Yep.
So in theory, cough medicine doesn't work.
But they sell tons of that stuff.
I actually don't know whether it's the paracetamol in it that makes them feel a little bit better.
Yeah.
But research has very thoroughly shown that it's no different to having like sort of a warm glass of water with honey and lemon. Now, you can't give honey to infants, which is below the age of 1, because it's too thick and it can get stuck.
And if it's non-pasteurized, then you've got all the other issues with it as well.
Yes, exactly. Yes. So you avoid the honey. But the point is that you're looking for something that is soothing. Huh. So what they do sell...
I'm still sitting here thinking, what, cough medicine really doesn't do a heck of a lot? Yet that's a huge market. I have no idea what the market for it is.
But there's a few things in cough medicine. So you'll often have something which will dry up your airways a little bit. Yeah. So that would help. But you can just buy sort of an anti-mucus type medication, so something for your sinuses, and it's also got paracetamol in. This is usually, not all of them are the same, but they tend to follow the same rules.
It's kind of like a cocktail of some sort. That it's a little bit of pain relief, a little bit of dry up your mucous membranes, something to maybe try to lubricate your throat, so that that's why it's syrupy, so that your cough kind of mitigates. But
when you say lubricate your throat, it's only really the fact that they often put it in a drink, so it's often in water, and it's normally warm water as well. Yeah. So you're not going to give hot water to a child, and they probably wouldn't necessarily enjoy the lemon infused water. They might do, but it's unlikely, and you've got to be careful with the seeds, and you're not going to give them honey. So what do you give them? Yeah. Normally it would be the paracetamol on its own. You'd also, depending on how young they are, you could often help clear their airways by sucking it out. Have you seen the sucker?
No.
You never seen the nasal aspirator?
Oh, those little ball things you go. Yeah, we used to use those.
So everyone. It
was gross.
Well, that's it. I've got a massive thing about mucus. So give me any other bodily fluid, but I don't cope very well with mucus. No, I don't like it at all. Okay. It's disgusting. I can't even say that word. That's why I say mucus.
It's that sucking out ball. Like you see, I bring back a whole bunch of memories there that I wish I didn't have.
Yeah, sorry, James. So I tried as much as I could to avoid using the sucker. The other thing you can do is actually put saline up the nose. This is, again, I'm talking about for infants now when they're tiny. Yeah. You can put saline up the nose, which I actually would recommend to somebody, but I found quite scary because you're putting a liquid into their only airways. Yep. So obviously do one nostril at a time. And then
do you think it really does anything cleaning it out? Do you think, really?
I do actually, especially when it's really sticky.
Okay.
Because it can be very sticky.
Softens it up a little bit.
And helps them clear it. Okay. Because they have difficulty clearing it. So that does help with a cough generally, if you can try and reduce the mucus in the airway. So it's something called a mucolytic you're looking for.
A mucolytic.
Yeah. So
I like that word.
It's a good word. The pharmacy for one of those.
I think just having the lingo is kind of cool as well.
So you know that a lot of medicine is in Latin.
Yeah.
So we have to get like a dictionary when you first start, a medical dictionary, and mine was battered in the first year because you don't understand anything, and then as you progress, you can sort of figure out the word because you don't realise you actually know a lot more Latin than you thought you did.
Right.
So it's basically like learning a whole new language. So you take your mucolytic. Paracetamol is always good for reducing fever and making them feel better, but it won't necessarily get rid of the cough.
Yeah.
Then the other way is that you want to just generally hydrate the airways. So if that's saline up the nostrils of a small child, or whether it's, you can actually buy nebulizers here.
Right.
And you
I
just have
those.
to,
a lot of those.
It's not something you'd ever really use in the UK unless you had something called COPD or really severe asthma.
Yeah.
But you can just put saline in it, and all it is like a vapor. So it's just a misty vapor.
You know what we used to, we didn't use these with our kids. I just remember having this when I was a kid, is we'd have the vaporizer and with a little bit of Vicks nasal rub in this little tub area, and then the steam blew over it and made the whole room smell like eucalyptus Vicks.
I bet that was awful. It just smelled like
it's terrible.
cold. Yeah,
it does. You go, oh, someone's sick in this room. It's just horrible. But I don't know. My grandparents and everyone used to think that because you were breathing in those fumes, it was helping to make you better.
It's like rubbing Vicks on your chest.
Yeah, it doesn't do anything.
Like,
it burns though.
I don't even know what's in Vicks because medically we don't use it. It's not something. I think it's got to be something more soothing. Otherwise, it would be in a prescriptive practice.
It's like eucalyptus or something. I don't know. It's like who knows what's in it.
I mean, it smells quite tinged with alcohol, doesn't it? So it's something to clear the airways.
Yeah, I don't know.
I know, and so no, don't use that. But coughs are a really difficult one because everyone wants a magic cure for a cough, and it just doesn't really exist. It's basically your airways are either overreactive, so they're sort of going into spasm, and that's fine to reduce that type of cough.
Yeah.
But if you have a cough where you're trying to get rid of mucus, well, really, you need to have that reflex, and you have to allow the cough to get rid of the mucus. And the only way you can help it is to reduce the mucus yourself through a tablet or through.
And everyone's had that cough where you need to get rid of that stuff because you wake up in the morning and it's not a good show. But
there is a miracle drug actually.
Well,
but you have to be. So I'm not telling people to go out and buy this. So it's called Clarinase.
Clarinase, okay, I know Clarinase.
Yeah, no, so it's not available in England. You can't buy it.
Oh, really?
And it basically causes what we call vasoconstriction. So it basically causes the blood vessels to the nose to squeeze. And because of that, you don't get as much mucus production. So you can go from having a cold to suddenly be like high on life because it also sort of increases your blood pressure. It can increase your heart rate a little bit.
We use Clarinase as an allergy pill as well.
Yes, it has. It's got an antihistamine in too. So you can use Claritin, which is just antihistamine.
Yeah.
And Clarinase is also got in the mucolytic, but it's a very strong one.
Ooh, okay.
So you shouldn't use it if you've got really high blood pressure, if you have problems with your heart. Generally, that is a drug that I don't think should be available over the counter. I think it should be one that...
And I think it is over the counter here, isn't it?
It is, absolutely. It is over the counter.
It's terrible.
But it's terrible, but it's also wonderful.
But wonderful, yeah.
If you're fit and healthy and you've got a cold and you... Say, for instance, you can't rest, which I would always recommend if you have a cold. But if you can't, you absolutely can't. You've got, say, a presentation to do that day, then that will see you through until you can get the opportunity to rest.
There's some other ones for flu and that we get here, and I can't remember what they are. But whenever you get one of these things happen, someone says, "Oh, are you trying this stuff? Are you trying that stuff?" And it's like, "No, I'm not." And they say, "Oh, you should try. It works for me." And there's a few of them like Clarinase, but there's a couple other things that people always recommend, and I just usually go, "Thanks for the recommendation. Yeah, I'll just keep doing what I'm doing."
I've started to become really quite cynical, and I just don't think, in this sense,
you're the least cynical person I know.
But I don't believe anything's magic anymore. Like I used to get really excited about things, and people would say, "Oh, just try this," and it's like, "Yeah, well, let's wait another 10 years and see what research comes out about it."
Yeah,
there's just nothing comes. Like I keep going back, nothing comes for free. Yeah. And so it's fine, but you need to think of it a bit more reasonably and think, okay, it's worked for you. Maybe I could try it a little, but don't get carried away with things. Yeah. There just isn't a wonder drug, and often in medicine we do start. We start prescribing something, but very regularly our prescribing habits change, and it's because down the line you might find that there is something else not quite right. That shouldn't put you into fear because of the length of testing that goes on. It takes on average 17 years for a drug to get into market.
It's a long time.
Idea.
That's a long time.
It's a very long time. But at the same time, I don't know, there are always going to be things that they haven't figured out.
Yeah. And then there we go. And then taking it right back to the kids, like you said, better to go easy on things than to start, front loading and looking for the miracle cures and stuff.
Yeah. Always conservative management first line. Like try and do something try and make something better without trying to give pills and potions first, always. That's the bottom line of everything in medicine.
There you go.
Yeah.
Simple. You know what? Why don't we wrap it on that, Jenna? And we'll get back really. So we got into a good 20% of our list, if that. Well, we got to 2 points. So that's not bad. But I'm looking down the list of things we have here. Next time we get together, let's talk eating disorders. Let's talk about plastics or cosmetics.
Oh yeah,
and
always. Actually, that's a good one to link with eating disorders too,
so
because
we'll put those two together.
Two go hand in hand.
And then we'll put the soda pop addictions in there as well. So we'll get going on those three. But I think talking about eating disorders and then talking about cosmetics it's just a huge. The cosmetic side is very interesting, and I think a lot of misconceptions about it because cosmetics covers. And I'm not talking about makeups. I'm talking cosmetic treatments and things. And there's just it's such a broad spectrum.
I know, and it's increasing every day as well because there's so much research funneled into that now.
And I think it's kind of some parts of it are very exciting, and parts of it are I'm not touching that. But I think it's really interesting and an interesting thing to look at. It's
definitely interesting because it looks very much at a physical side, but it also looks very much at an emotional and a psychological side.
There we go.
I can't wait to talk about it, James. But there's so much for us to talk about.
Well, next time, that's where we're going. So it's going to be a lot of fun. Jenna, thank you very much.
Thank you.
You have been listening to DocTalk, a Podaholiks podcast with Dr. Jenna Burton. Want to get a question to us? Email podaholiks@gmail.com and follow us on the socials, Instagram and Twitter. Of course, even YouTube @Podaholiks. It's been great. Thank you very much for spending your time with us, and we'll do it all again really soon. So long for now.